Okay, thank you, Lynn. Good afternoon, everybody. As mentioned, I'm Clare Chapman, and together with Dr. Natalia Bilton, we're hoping to inspire you about VR and why we've chosen to incorporate it into our pedagogical practice for teaching anatomy and physiology. So first thing we'd like to do is sort of set the scene and the context as to the kind of students that we're getting through into our cohorts at the moment. As you can see, the world is a rapidly changing place. And studies show that our current students are really interested and are really worried about the current global economy and global issues, such as the ones that are on the screen there. And with technology and also social media, the students are discussing and concerned about these issues more than they ever have before. And if we have a look at what's happening in secondary science in Australia, we can see that there is a decline in the number of the three main sciences in high school. The graph there shows between 1992 onwards that there is still that steady decline in the number of students taking those subjects. And also in STEM, there is also a decline, and we're actually at the lowest point that we have been in the last 2 decades, which is a concern, because that's going to flow on to the number of students that are motivated in taking sciences in the tertiary sector. So not only is it the number of subjects that they're taking, studies have also shown recently that performance in science and science literacy, and there was a big comparative study in 2015 that looked at PISA, and that scientific literacy is also falling dramatically as well. So that's setting the tone for the kind of students that are entering into first year university.
So this slide is designed to represent the National Science Statement. So the government has identified science as one of the critical elements in the future in order to maintain high wage jobs and to foster economic prosperity. Science is a critical element. And so the Australian government released this statement to show the importance that the Australian government places on having a strong and stable science system. And this document is designed to be a decision-making guide to ensure an enduring foundation for Australian science. So I guess the main point, just to reiterate what Clare said, is that the enrolments in science at university at this point is strong. It's stable but strong. It hasn't increased, but these students do not come to university with a scientific background. That is the major issue.
Okay, so with all these changes with what's going on in society and also with major technological changes, which is always occurring at the moment, that means our educational pedagogical practice also has to change. And what that is leading to at the moment is change in educational paradigm, which I will talk about next. But just to give you a bit of food for thought, there's a 1-minute video we'd like you to watch. I find that video very powerful. It highlights that the world is forever changing, technology is forever changing, and research is showing that students are going to have a number of jobs. Long gone are the days where you leave school and you have one job for the rest of your life. And they're going to have to keep up with technological changes and also be able to problem solve. And so what that has led to, in 2014, Kavunja actually has described that we're heading into what we call the new learning paradigm, which is changing educational practice. And what that paradigm is doing is actually merging our normal teaching practice with developing 21st century skills in our students. So today, because of those changing environments, we need to foster those 21st century skills in students so that they can cope with the changing society. So inbuilt with that paradigm, we've got constructive science, and where Natalia and I are trying to make our students active constructors of knowledge. We're trying to implement different things in our classroom where they can accumulate knowledge but also incorporate those 21st century skills. And that's where we started to think about how we could incorporate virtual reality. At the same time, our modern learners, they're demanding a lot more autonomy and choice in how and what they are learning. And so that is all part of the new learning paradigm.
So just to align our approach with CSU's graduate learning outcomes. So CSU aims to produce graduates that are professionals and that can use technology in their workplace and also a part of their lifelong learning. So it fits in with the current learning outcomes for child stirred.
So we had a look at and the university itself, what CSU graduates, the kind of skills that we want them to be leaving with. So the first one, we want them to develop ways of thinking. So a way that they can work creatively with others, how they can problem solve real world issues and real world scenarios, how they can reason effectively and work with others as well, articulate their findings. And also, whether they're self-motivated, we're trying to encourage students to become lifelong learners and ones that are adaptable and also flexible to what's going around. We're also having a look at trying to encourage ways of working. So making sure that our students are competent in the way that they use their written and oral language, whether they're open-minded and ready to listen, and whether they're sensitive to cultural differences as well. In terms of tools for working, and this is where the VR fits in, so we need our students to access and evaluate information because we're living in the digital world, and also use and manage that information, and also look at things like plagiarism and copyright and digital citizenship. And the last thing, in terms of living in the world, we want our students to understand the rights and responsibilities as global citizens, be self-directed and be adaptable. So we took all of those into consideration, and we believe that virtual reality can actually foster some of those. So we're seeing now that we've got this new generation of learners that are coming in as first year, second year university students. So we're currently in this era of ubiquitous access to technology, and the Generation Z students that was coined by Rothman in 2016, they have grown up and been born in the digital world. They can access any learning material at all, educational videos, apps, and the like. And Generation Z are also using social media greater than any other generation, and they are wanting to use that kind of social media in which to learn and also to communicate. This generation are known as the multitaskers, and they can do many things at once, and they're motivated by interactive games, collaborative things that are happening online, and this sort of technology is engaging Generation Z. We quite often find in the classroom that without technology, the students are actually quite lost, and they need to be. And so with all those things in mind, once again, we came back to the fact that virtual reality has many affordances that covers those.
So in terms of our student needs and our student cohort, Here at the Port Macquarie campus, we have a very distinctive, well, I guess it's colossal CSU. We have a very distinctive student cohort that come to us with varied educational backgrounds. They're usually admitted to university via non-standard pathways. Furthermore, they usually don't have family members that have attended university, so they're first in family. We also have a high percentage of Indigenous students and a high percentage of students from low socioeconomic backgrounds. And as a consequence of these factors, these factors actually predispose our students to attrition. And so in order to counteract that, these students need scaffolding, practice, feedback, engagement, and interactivity to overcome their predisposed factors to attrition.
Okay, so we actually teach anatomy and physiology to a large number of students in quite a range of subjects. And so we actually want to make sure that we're using best pedagogical practice. And so that's where our journey of starting to look at virtual reality began. So we started to have a look at what virtual reality actually is. And so when we have a look at it, for those of you who are listening in that may not know anything about it, so it's a completely digital environment. It's based on three-dimensional environments which are supposed to be realistic to the real world. And it's very immersive, and it can be either single user or, as we've found, we can also use it in group settings, which the Generation Zs, in terms of being social, really, really enjoy. So what we found was in the research that virtual reality has quite a number of affordances and benefits that really suits us in teaching anatomy and physiology. So in terms of the affordances that VR has, obviously interactivity is one of the most important ones. So the kids are interacting with the learning environment and becoming completely immersed in that. The 360-degree visual authenticity gives the kids an idea of sense of presence and that immersive feeling, and we'll have a look at the benefit of that shortly. The 360-degree navigation gives the students a bit of choice as to which direction they want to go, and also at their own pace. And the stereoscopic 3D images these days, in terms of technology and graphics, are just amazing. And we'll discuss later how blown away the students are with this technology. The first-person perspective, it allows students to actually take on a personal role, and it aids in decision-making in terms of a 21st century skill. The in-situ contextual information that's inbuilt to the apps of virtual reality actually allows us as educators to help plan how we can use that into our classrooms. The simulations are really, really important for us, because what they can do is actually make difficult and also concepts that can't actually be seen for real suddenly become visible to the students. So in terms of the benefits, this list here is not exhaustive. There's lots and lots of learning benefits. For example, studies have shown that students have better retention of information having used the VR. They have also better understanding, and their concentration levels are also heightened with the use of VR. Many studies, one of the latest ones by Albee in 2016, found that student outcomes and academic performance in science also increases with the use of virtual reality in the classroom. One of the things that we've seen by using VR is that increase in motivation for learning. The students are super keen to get onto the VR headsets when we bring them out. And again, there are several studies to show there's a link in increasing motivation and engagement. One of the 21st century skills is increasing scientific literacy. And so embedded into the VR apps, the students can enhance their literacy skills, as well as some of the other 21st century skills as well. So if you can imagine atoms or inside a cell, things like that, VR makes visualizing really abstract concepts much, much easier. In terms of immersiveness, obviously there's much higher focus levels there's less distractions, and studies have actually found that there's less behaviour difficulties in the classroom as well because of the concentration level. So it's starting to allow us to restructure our teaching. And if we have students on VR, what we found is because it is student-centred, it leaves us much more time to work with students that actually need our time. So lots and lots of benefits of virtual reality, and so we continued our exploration into its use.
So when you think about virtual reality, it aligns well with what we currently know about how the brain learns, and I'll only just mention this briefly, but it provides multisensory input, so that draws the signal amplification for getting the information into the students. So increases attention, and it also, by the interactive aspect of it, it allows students to learn by trial and error, and that is conducive to this active learning cycle presented by Zool, which is based on neuroscience. The other good thing about using virtual reality is that here in Port Macquarie, we're trying to really hard to introduce Indigenous pedagogy in anatomy and physiology, and using virtual reality actually hits 6 out of the 8 Indigenous ways of learning. So it not only supports the success of our Indigenous students, but also of all students. And the most powerful aspect of virtual reality is its power in allowing place-based learning. And so, for example, in one of the applications, students actually sit in a little spaceship and they actually travel in a blood vessel within the red blood cells. So you can't really get anything place-based learning in anatomy and physiology without VR.
Okay, so part of our research, we actually found that there continues to be widespread growth in interest and also the development of virtual reality. And as you can see here in this graph, just looking, I mean, we teach the healthcare industry students that the growth is expected to be up into the $5.1 billion by 2025. So the health sector is definitely one area that's looking at virtual reality use, and we're going to show you an example of that shortly. So VR is becoming much more commonplace in the health industry already. If we look at current amounts that are currently being used in VR, in 2012 to 2017, we've seen that massive growth from 500 to 900 million. And as I just said, they're expecting by 2025 for that to have jumped to 5 billion. And they're hoping that millions of people around the world are actually going to benefit in the health industries by the use of virtual reality. And we have lots and lots of people, companies who are putting lots of money into innovating and using virtual reality in the health industries. There's some listed there. Now, currently, virtual reality is already being used in the health industries. So it's being used as a treatment method. So, for example, people who have had stroke or injury, they're using that, the people put the headsets and the goggles on and they're following movements, and it's being used as a therapy, physical therapy. People with phobias and anxiety are also using VR treatment. Post-traumatic stress syndrome, all the mental illnesses and dementia patients are also benefiting from the use of virtual reality in health. So healthcare workers are also using virtual reality to help them with day-to-day jobs. And remote areas are also using virtual reality to increase access to doctors via virtual visits, which is pretty amazing. Training of healthcare staff, virtual reality is becoming much more popular using real life scenarios, and it's becoming more popular in aged care facilities for both treatment and anxiety, and also for just pure entertainment value. So patient education is also an area that's being used. So for example, patients are being taught about things like smoking, hypertension through the use of virtual reality. And as you can see there, the young fellow is using virtual reality for dentist visits for those who are stressed by that. So one of the cohorts that we actually teach are radiation science students. And we found in our research that the future of radiation science is also emerging with virtual reality. And so not only do we want to use virtual reality to improve our pedagogical practice, but we need our students to know how to use virtual reality because it's going to become part of their job description. So we have a short video as to how virtual reality is being used in radiation science.
Introducing Anatomy Viewer by The Body VR. Anatomy Viewer allows anyone with an HTC Vive or Oculus Rift to view CT and MRI scans as 3D volumes in virtual reality. You can import your own DICOM files and watch as they are converted to 3D volumes in real time. The volumes can be freely scaled, rotated, and cropped. Users can add annotations to specific areas within a scan to indicate lesions and tumors. The volumes can then be saved and uploaded to be viewed anywhere in the world. All patient health information is removed in the process. You can select between multiple preset color schemes and even create your own. There are multiple environments built into the Anatomy Viewer to suit your preference.
So you can see there that our health science students, as I said, not only can they learn better by the use of virtual reality, but virtual reality is going to be something that they are going to use in their profession. So we started to have a look at what Anatomy VR apps and software was available that we could use to teach anatomy and physiology, and in a cheap way, to be honest. And so here's an example of, or we might just watch one of them, of the virtual reality that we use here at Bilton. The students get a fully immersive environment in which they can manipulate at their own pace. Here is a photo of our BMS 191 students in semester 1 this year using virtual reality during our practical lab sessions, and absolutely loving it, you have to say.
So just to give you a little bit of background, we've only really just started doing our own sort of trials using our own equipment, and we've only just purchased basic headsets. So we really want to pursue this further in next year and want to increase the interactivity of the headsets and also extend it to other subjects.
Okay, so there's some more photos of our students in our laboratory, and the feedback we got from them is we want more of it. So they were super engaged, super immersed, and really, really enjoyed the whole process. We also had to go with virtual reality with BMS 192 this semester, and we chose the digestive system we found a really good app for digestive system, and the kids really, really enjoyed that. So it's not hard to implement virtual reality into your classroom. So this is a bit of a screenshot. I just went to YouTube and just put in VR 360 anatomy, and you can see there that there are lots of ones that you can use very quickly that are free, and the graphics are amazing. And so here is just one quick example of one that we've used. particular app actually covers all of the body systems that we cover in 191 and 192, and it's super helpful. So just as an added activity that we use in our lectures and also in the labs, we get the students to pull apart the skeleton and increase their knowledge. I'll skip through these ones. These are just more examples of what we use in our classes.
So the initial findings of our little pilot, so there was initial apprehension. There was sort of a little bit weird about, the students felt a bit odd about putting the headsets on, but that was very quickly overcome by their own peers when they saw, wow, you've got to try this, it's awesome. We also found that, you know, it was the very first time a lot of our students actually saw virtual reality or experienced the virtual reality. Again, the immersiveness is a key factor. And sometimes you get students that come to the lab and you sort of are struggling to get them through all the lab activities. This one required no coaxing or no effort on our part. It was purely student driven, and they really pretty much solved it to themselves. So that was really, really useful. So our current directions, if we want to explore this more formally and further, we really want to secure or maybe find sources of funding where we can actually get some more interactive headsets. And then we really want to test and do an experiment to see whether actual learning outcomes are actually being changed. We do have anecdotal evidence to suggest that, but we would like to do a formal study on this in order to, with the potential, if it does really affect learning outcomes, it certainly increases engagement, but if it does increase learning outcomes, we definitely want to roll it out to the rest of the campus.
Okay, so hopefully we've given you a little insight into how it can be used and what we've been doing, and we thank you everybody for listening to our spiel on virtual reality.